Hello, hello everyone. I'm Tito. Now I'm responsible to give you lectures on the last chapter of General Pathology. The chapter will discuss about extrinsic factors, and this is the part 1 of the lecture. So we will have next lectures, I think next week, and it would be the part 2. Okay, so all the materials in these lectures are only intended for teaching purpose and not allowed to be used by any other party without our permissions. Okay. For the first time, I would like to give you some brainstorming about disease. Okay, disease is definition of disease. There is an alterations of tissue that cause symptoms, and then if you learn about disease, you should also familiar with the epidemiology. It means that where and when the disease occurs. And then when you talk about disease, you should also consider the etiology or the cause of disease, and then pathogenesis. Pathogenesis means the progressions of disease, and then morphology that related with structural changes and also its functional consequences on disease. And if you learn further in the clinical science, you'll also will learn about management, prognosis, and then preventions of disease. However, in our subject now about extrinsic factors, we will mainly focus on etiology, okay, and also pathogenesis and morphology, okay, and also functional consequences. This is our focus for this lecture, okay. And then I think you already learned from many subjects in veterinary medicine since first semesters. You already learn about some etiology, for example, in microbiology and parasitology, and also in biochemistry, for examples. And today, in this lecture, we will discuss some of the etiologic factors that cause disease, and all of those factors originated from outside. Previously, last week, you learned about intrinsic disease, intrinsic factors that related with factors that already included in the animals, for example, genetic factors. And just like I mentioned in the previous slides, we also will give some explanations on the pathogenesis. Pathogenesis is the evolutions or mechanisms of disease. And then also, don't forget, if it's pathology, you also have to relate the pathogenesis with structural changes or structural alterations in the tissue. And eventually that all the morphological alterations, including pathogenesis, will have a consequences on the functions of tissue. Okay, and this is very important. Functional consequences related also with clinical science, and then it will help you much when you learn how to diagnose the disease clinically and also to perform an appropriate treatment. etiology, simple. Etiology is the cause of disease. Okay, so we learn many causes of disease. Etiology, of course, it's strongly related with the diagnosis of disease. If we understand the diagnosis, there will be the nature of disease also understandable, and then we can perform the correct treatment. So when we talk about etiology also, of course, related with agents. Agents can be infectious or non-infectious, and interactions of agents with the environments are related with factors that we call a predisposing factors. Related with predisposing factors. Okay, predisposing factors is all kinds of factors that can make animals more susceptible to disease. Predisposing factors related with intrinsic factors, it means also genetic, okay, and also environmental factors. And then in etiology, we will also will relate some of the predisposing factors with other factors that directly responsible for the disease progressions. Okay. Here, this is etiologies. Etiologies can be intrinsic factors or extrinsic factors. Okay, and then all these factors will affect the host that may eventually lead to a pathologic conditions that resulting in illness. Okay, wait for a moment. Okay, hosts and agents are closely intermingled. There are a vice versa interactions between host agents, and then it's all related with many other factors, which is intrinsically and extrinsically factors, and all related with illness. So if the agents become more dominant, illness will occur. So how about extrinsic factors? So extrinsic factors are agents that causing tissue and cell damage. Agents that causing tissue and cell damage that originated from outside, originated from the environment. It can be physical factors, for example, traumatic events, or it can be chemicals. Okay, there are many harmful chemicals that can cause disease or tissue damage, and the most common one is biological factors: bacteria, virus, fungi. Those are examples of biological factors. And also deficiency of some compounds, which are minerals, vitamins, okay, or other substance that may disturb the homeostatic imbalance. So first, physical. Okay, physical can be a mechanical trauma, electric shock, temperatures, irradiations, okay, or heat, Okay, heat or extreme cold shock, for example, related with physical factors. Chemical factors related with harmful chemical compounds. It can be a biological originated compounds like toxins, okay, toxins from animals, venoms, okay, or toxins from microbes, or a synthetic chemicals, for example, pesticide, herbicides, or it can be also environmental toxins like heavy metals, for example. Okay, the most common extrinsic factors, and also I think majority of the extrinsic factor that I'm going to give you lectures is somewhat majority related with biological factors. It can be a cellular agents, virus or prion. It means acellular means they don't have organelles. Even as acellular agents, they do not have a DNA, but infectious. Okay, for example, this one here, prion. Okay, I'm going to give you some insights about prions later in the further slides. And then prokaryotes, bacteria, okay, or eukaryotes, it can be fungi or algae, or parasites like protozoa, worms, and also insects. And last but not least, I'm going to give you also some lectures on the deficiency that cause imbalance on homeostasis. For example, deficiency on nutrition and deficiency that related with environmental factors. Okay. So, for the first time, I would like to give detailed explanations on physical factors. Physical factors actually related with traumatic events. If there's traumatic events, there is the force that hit the body parts, and the severity of lesions on traumatic events will related mainly with the intensity of trauma and also affected body parts. For example, head trauma causing more serious damage rather than the trauma in the extremity. And also frequency of trauma, more intense, more frequency will make more severe damage, and type of tissue. Okay, hard tissue, trauma in hard tissue will have a different response with trauma in the soft tissue. Okay, and then in general, skin is more resistant to trauma compared with visceral organs because skin has a epidermis and also thick dermis that become a physical barrier. For visceral organs, they are not that thick, and then they do not contain a lot of collagens that makes visceral organs vulnerable to physical damage. Therefore, many physical organs will be covered by physical barrier. For example, lung, quite soft tissue, and lung fully covered by ribs, for example. Usually for visceral organs, they are covered with some protections barrier. So, physical trauma will inflict or will make wounds as one of the consequences. Wounds can be categorized in the Latin wounds called here fullness. There are many types of wounds, many categories of wounds. First, the examples of the wounds can be contusions. Contusion means bruises. Bruises. We can see hyperemic or reddish area due to ruptured blood vessels, or abrasions. Okay, it means abrasions, desquamated or loss of skin epithelia, sometimes with or without penetrations in the dermis or the underlying tissue. Erosions means loss of skin or loss of mucosal epithelia. It means erosions related with loss of the protective barrier. So maybe you are curious, what is the difference then between abrasions and erosions? Okay, so abrasions, it should involve a physical force. Okay, abrasions should involve a physical force. Erosions can be caused, for example, not by physical force. It can be also caused by chemicals, for example. Some strong chemicals that can cause corrosive behavior may inflict tissue and then cause erosions. Okay. In abrasions, there should be a physical force applied to the tissue. And then incisions, cutting trauma. So the incisions will be characterized by elongated wounds, long, slender wounds, and the length of the wounds is more dominant than the depth of the wounds. Okay, that's incisions due to sharp objects. Okay, it has in incision it has narrow edge. And then stab wound. Stab wound in the Latin we call it punctum. If stab wounds, the depth are more dominant than the length of the wounds. Okay, maybe small size, but deep trauma. Okay, it's related with stab wounds. Or laceration. Lacerations means torn wounds. Okay, easy. Or some wounds can be caused by compressions due to injury of a chronic or prolonged pressures. For example, decubitus wounds. That's due to compressions, prolonged compressions. You know, decubitus wounds. Decubitus wounds is wounds that are affected of a compressed tissue. So in the area that receive chronic compressions, it will be moist, and then in the chronic stage the tissue will be lost and then causing open wounds. We call that decubitus wounds. For examples, in animals that has a paralysis, chronic paralysis in the paralytic area that usually touch the surface, it will produce a wounds. We call that decubitus wounds. Okay, due to chronic pressures or prolonged pressures for a long time. Here, this is a torn wounds or lacerations in the neck of a dog here. Okay, usually these deep laceration wounds can be caused by a thick dog collar, for example, thick dog collar, or lacerated wounds due to trauma, for example, caused by barbed wire, for example, in this case here. Okay, there are open wounds due to torn tissue because of barbed wire. Okay, and then okay, this one here is the abrasions, examples of abrasive wounds. Abrasive wounds usually related with prolonged exposure or prolonged force in a surface of a tissue. Usually we can find it in the tip of a bone, in the uh, superficials of animal bodies. For example, here this is the tuber coxae, or we call it coxal tuberosity. Chronic irritations. Chronic irritation, it means there is chronic forces that apply to the surface in a prolonged time, and eventually it causes a open wounds. This is what we call as abrasions. There are forces applied to the surface of the affected area, and usually abrasions related with chronic events. However, in some acute events, it can be also occur. Okay. Then temperatures. Temperatures cause also fullness or wounds. High temperatures cause burn wounds. Extreme high temperatures cause burn wounds. Burn wounds can be categorized as first degree, second degree, and third degree. First degree only related with superficial part of skin or mucosa. Okay. If in skin, first degree related with damage in the epidermis. And first degree usually mild and only affect epidermis, okay, or upper part of dermis. And usually for first degree, it has a maybe sort of superficial erosions, or it only appears as erythema or skin redness. Second degree, okay, related with high loss of tissue. So for second degree of burn wounds, there are loss of epidermis and also dermis. There are damage in epidermis, of course, and also dermis. It can be upper or lower part of dermis. Third degree of burn wounds, it means that it's already reached the deeper part. It's a transmural burn wounds. So it's not only inflicted the epidermis, but also dermis and subcutaneous tissue. And usually for third degree, there is extensive necrosis of tissue. Okay, from upper part, epidermis or epithelial layers, lamina propria or dermis, and also subcutaneous or submucosal area. Burn wounds can be caused by fire, okay, electricity, chemicals, and even irradiations. Here, you can see the skin anatomy. I think you're already familiar with this. This is the skin, dermis. Okay, this is the hair follicles with underlying tissue that consists of blood vessels. Okay, this one here, this is the annexal gland, sweat gland, or maybe sebaceous gland. Okay, so in the first degree of burn wounds, it's only affect upper part. It means only affect the epidermis, or limited to upper part of dermis here. And second degree of burn wounds will affect epidermis and dermis. Okay, so second degree burn wounds is more severe, of course, than first degree. And third degree will affect transmurally all part of skin, from epidermis to subcutaneous area, and even it can also cause a muscular damage. Okay, and from this all type of wounds, the regenerations, fully regenerated wounds, occur here in the first type. Second type is there is moderate regenerations, but it can be fully regenerated to normal tissue. But third degree wounds, third degree burn wounds, usually will not be regenerated into normal tissue. Okay, I'll explain about this later. Here, this is another illustrations of burn wounds. First degree only affect the epidermis, usually appears as erythematosus or skin reddening. Second degree can be appear as a vesicles, okay, or open wounds, but limited only in the limited only in epidermis and dermis. Or third degree, this is the most severe form of burn wounds. So there are extensive necrosis in all part of skin tissue, okay, and also the underlying tissue, the subcutaneous tissue and also muscular tissue. Okay, first degree burn wounds, for example, due to a sunlight exposure, ultraviolet exposure to the hairless skin. Yeah, it's usually only reddening or erythema. Second degree, for example, causing blisters, for example, burn wounds due to hot oil or some degree of moderate fire accidents, okay, causing blisters, and also vesicles. Vesicles means sac filled with fluids. First and second degree can be fully regenerated into normal skin. Okay. However, depending on the severity of the lesions, first degree burn wounds will heal and regenerate faster than second degree. But the first and second degree, depending on the severity, will fully regenerate into normal skin or normal tissue. Okay, first and second degree fully regenerated. Okay. That's the important things that I have to underline. However, for third degree of burn wounds, the remodeling will be resulting in scarring or scar tissue or formations of fibrous tissue. There will be no normal skin tissue. So third degree, the remodeling will not form as new skin, but will be formed as scarring. Okay, extensive scarring. Okay. And then burn wound can cause some functional consequences. Of course, burn wounds cause tissue damage. However, one of the most serious consequences of burn wound is this one here: fluid loss. Okay, more extensive the wounds, more extensive the burning lesions, more fluid will escape. Okay, animals may suffer from extreme or severe dehydrations due to extensive burn wounds, and death may occur due to hypovolemic shock. Okay, please refer that to our previous lecture on circulatory disturbance. Okay, and then of course burn wounds causing also uh, open lesions, open wounds that can be assessed by secondary bacteria that act as secondary infections. If there are secondary infections, the healing will be slower. Okay. Here, this is an example of second-degree burns. The reddish part, reddening part here only affected the epidermis. This is the first degree of burn wounds. However, loss of tissue here may related with second-degree burn wounds. Okay. Here, the tissue covered with some whitish materials. Maybe this whitish materials related with edema on the dermis or subcutaneous area. Then temperatures also can be related with high body temperatures or hyperthermia. Okay, sorry, I passed this translation, sorry, but hypothermia means higher body temperatures than normals. It can be also affected by high environmental temperatures. And then the consequences of hypothermia, it can be fluid loss. You see, if there is hypothermia due to fever or high environmental temperatures, the skin or the body through the skin will release more waters. Okay, will release more fluid because the fluid take the heat and then release it outside. If there is more fluid loss, it will eventually resulting in higher blood pH. Okay, why? Because the fluid that escape in the hypothermic conditions not only takes water but also ions. Okay, these ions regulates the pH, okay, the acidity of the body parts. Okay, fluid loss also will make the concentrations of plasma become lower. The plasma volumes become lower. The lower plasma volumes will make the hemoglobin and RBC number will be higher. Okay, as you know that hemoglobin and RBC usually represented in a volumes. Okay, number in the volumes. Number per volumes. If the volumes of the blood decrease due to fluid loss in hypothermia, the concentrations of hemoglobin and RBC will steadily increase. Then the most serious consequences of hypothermia is heat stroke. Here, heat stroke. Heat stroke may associated with some symptoms. The symptoms can be hyperpnea. It means high frequency and high intensity of breathing. And then it can be also high intensity of heartbeat or tachycardia, vomitus, okay, puke, and in the serious way, heat stroke will make shock. Shock will make supply of oxygen in the body become low, okay, and it will lead to tissue necrosis, in particular in kidney. So it is very serious conditions. Okay. here, degeneration and necrosis in the kidney is actually due to hypoxia, because heat stroke causing shock. Shock and hypoxia is closely related. Okay, and then this is a hemorrhages, pinpoint hemorrhages or ptehiae in the skin of dog that died of heat stroke. Okay, usually during heat strokes there will be increased there will be damage also on blood vessels, because blood vessels needs oxygen for its functions. Low oxygen cause damage in the endothelial cells that makes hemorrhages, and also during hypothermia there will be increased permeability of blood vessels that makes the red blood cell escape and then causing hemorrhages. Next is extreme temperatures. Before our hypothermia, high temperatures. Now is extreme low temperatures. We call it hypothermia. Okay, hypothermia, for examples, due to extreme cold. Okay, for examples, there is no proper protections during winter season. Okay, human mostly affected by this. Some animals also. Extreme cold can cause a depressions on the central nervous systems. Why? Extreme cold makes the neurotransmitter cannot be functioned properly. Okay, and then depressions of central nervous systems will lead also to some disturbance in the vital signs of body. For example, disturbance in the heartbeat. Okay, and then because the brain cannot work properly, animals and human will be in coma conditions that also may lead to death. And then extreme freezing, extreme cold in environments can cause water crystallizations within the cells that may cause necrosis. Okay, these water crystallizations can be traumatic to cells, and the cells can not be functionally cannot be properly functional. Okay, cannot be properly functional, and water crystallizations also may increase the cytoplasmic ions. Why? Because the cellular pump in the membrane, in the cell membrane, cannot work properly. Therefore, the cytoplasmic ions will keep more waters, and the crystallized waters will also damaging the surrounding cells. Okay, and it is very common that in freezing it will cause a thrombosis, because extreme freezing will cause also endothelial cell necrosis due to this water crystallizations. Endothelial necrosis will cause a blood coagulations that leads to thrombosis. Thrombosis will obstruct blood flow, and it causes ischemic lesions. We call it as infarcts. Okay, I think you're already familiar with infarcts because we already discussed that previously in the chapter of circulatory disturbance. Okay, you can refer to the lectures to the link of circulatory disturbance. I also provide that in my YouTube. And then extreme cold or extreme heat both causing the same lesions. There will be hemorrhages in the tissue, in the skin, and also hemorrhages in the physical organs. For example, this hemorrhages in the lung due to massive endothelial damage. Okay, so extreme cold, extreme heat both are causing endothelial damage that will lead to hemorrhages. So this other type of physical factors that can cause damage. Here, electricity. Electricity, the severity of electricity related with currents intensity, voltage, and durations. Higher in currents and higher voltage will inflict more damage. Longer durations, it will also inflict more damage. Okay, so in general, what really happened in the electric shock that causes damage? So electricity may involve in the disturbance on heartbeat. You know, for heartbeat, there is what we call as electric conductions between muscle fibers, okay, or between nerve fibers, okay, in the heart. So these electric currents will will break the imbalance of the on the impulses that transferred between nerve or muscle fibers. Okay. Therefore, heartbeat will be affected. And then electric current, severe electric currents may induce spasms of respiratory muscle. Why that happen? Because electric current, just like I said, will make disturbance in the electric conductance. Okay, and it makes the muscular tissue will contract frequently, okay, with higher intensity. And then these electric currents also will affect the transfer of neurotransmitter in the central nervous systems that may lead to some disturbance in the conductions of impulse in the brainstem, for example. And also electricity can cause serious burn wounds. Here, this is one example of electric shock that caused by lightning strikes that caused more than 300 reindeer died in Norway around 2016. Okay. So the source of the electric strikes can be natural sources, for example, lightning, or it can be from electric installations. So next, it will be about radiations, okay, or irradiations. Both of these terms actually a bit different. Radiations means release of ions, release of radiated substance. But irradiations is a amounts of radiations that affect surface. That means irradiation. Okay. But usually we can use both radiation or irradiations. Okay. And then irradiations or radiations cause cell damage. Why? You know, the sources of radiations, they can penetrate deeper into the structure of cells, in particular short wavelength radiations. For example, gamma ray. Okay? Gamma ray has very short wavelength. The short wavelength make it more easier to penetrate the cells and tissue. Okay? The short wavelength of gamma ray can cause destructions in the structures of DNA, can make damage in the structures of DNA in the nucleus, or nuclei, and also in the chromosomes. Okay. Therefore, severe exposure to short wavelength irradiations may cause damage of the tissue. Why? Because they will shut off the CPU of cells. They will shut off the nuclei. They will shut off the nuclei, okay, and will cause a cellular necrosis. However, prolonged radiations, okay, with maybe lower intensity, not causing cell death, but it will cause some changes in the structures of DNA. Okay. Changes in structure of DNA cause mutations that sometimes may lead to tumors. The tumors can be any tumors, skin tumors, or maybe bone marrow tumors, lymphoma, for example, leukemia, many types of tumor that depends on the affected tissue. So here, this is the main mechanisms of irradiations that cause cell damage. It's all related with damage of DNA in a cell. The radiations can be direct or indirect attack. Okay, direct attack means the radiations will penetrate the cells and they will also attack the DNA in the nuclei and makes water molecules become ionized, and then there will be release of electrons. You see, ionized water molecules, okay, will make the waters cannot be functions properly, so the cells cannot use waters, and it will cause a cellular apoptosis and even cellular necrosis. And then the most harmful condition is if the ionized water can form a highly reactive molecules. Here we can call it as a free radicals, for example, hydrogen peroxides or hydroperoxyls that damaging the cells. Damaging, for example, the nuclei or cell membranes. Okay. Release of electrons cause instability of nuclei and also cell membranes that leads to cellular damage. Okay. And it can be also indirect attack. Indirect attack means the free radicals produced by the interactions of radiations will bind the DNA. Okay, will bind the DNA. So usually indirect attack related with lower concentrations of free radicals. However, these free radicals can be still damaging, not directly causing cell lysis, but they can, because they have a small size, they can be absorbed into the nuclei, and then these free radicals will take electrons from DNA that makes the DNA structures change. Okay, and then in some part, changes on DNA structures can lead to mutations and cell damage. Here, indirect attack related with low dose of radiations, not only causing necrosis, cell death, but also can cause carcinogenesis or tumor formations or induction of cancer. and even the genetic effects can be seen in the offspring or uh, in the babies that in the babies or in the animals babies may have sort of abnormalities due to these conditions. For example, this happens in the cases of radiations after atomic bombing in Japan. Many cases of tumors occurs, okay, and then many offspring, many babies that were born after the bombing from affected parents will have many structural or congenital abnormalities. Okay. Radiations can be from alpha ray, beta, gamma, or X-ray. Okay, but shorter wavelength will cause more serious damage because they more shorter wavelength they will easily penetrate the cells. Okay, here related with damage of DNA. Extreme damage, extensive damage can lead to cell death, but more milder damage may cause cancer or hereditary defects because there is changes in the structure of DNA, okay, that due to mutations or other changes of DNA. Okay. So, clinical symptoms of radiation injury can be varied from leukopenia, vomiting, and others. But if you can see here, the clinical signs related with cellular death, for example, necrosis here, whether it can be epithelial, leukocyte necrosis, or anemia due to necrosis of erythrocytes, or they can also, the irradiation can also stopping the cell functions. The cell functions regulated by DNA. DNA not work properly, it will lead to cell function separations. Therefore, the cells cannot produce normal cells or cannot do their regular functions. For example, separations in the bone marrow cells will lead to leukopenia or thrombocytopenia, and even also anemia. Okay, this is separations of bone marrow functions. It's very common in the case of irradiations. We can find it, for example, after the atomic bombing in Japan at the end of the World War II, or in the Chernobyl accident in Ukraine. Okay, now it's about biological agents. Biological agents can be varied: virus, bacteria, fungi, parasites. Okay, just like I mentioned in the early slides, it can be also related with nematodes. Okay, all these agents causing damage in the cells, causing pathologic conditions, and depends on the type of agents. Some agents may produce toxins that related with surrounding tissue damage, or the agents, for example, like rabies virus, can enter the cells. They can make replications, and then after replication, they will break the cells. Breaking the cells means cells will die eventually. So, in viral disease, the main mechanism is virus cause replication within the cells. More replication of virus will make the virus escape from the cells. When the when there are a lot of virus escape from the cells, of course the virus will make destructions on cells, particular destruction of cell membranes. Okay, therefore they will be released and then infect more cells. Okay, viral replications related with cell necrosis or cell degenerations, because viral necrosis usually, viral infections will make the virus affecting the DNA function. Okay, as you know, when you learn in the biology, some virus will bind their DNA or RNA to the host nucleic acid, and then it makes the function of nucleic acid of the cells cannot work properly, will cause cell death or even cell functional depressions. So for viral disease, there are some patterns on viral disease. So it can be causing direct necrosis. We call it acute cytolytic. It means the viral replication lead to cell death. In the case for herpes, pox virus, papilloma, okay, or the virus causing immunologic reactions. So virus infiltration into the cells will activate the leukocytes, and then the leukocytes will, for example, lymphocytes will form antibody. However, this antibody, if it binds with the viral antigens that express in the surface of the cells, it will lead to hypersensitivity reactions. You know, hypersensitivity type 3 can cause by these conditions. For examples, in the case of feline immunosuppressive virus, okay, causing immunosuppressions, because feline immunosuppressive virus can penetrate the bone marrow, and then cells that are responsible for formations of leukocytes will not be formed properly. There will be low leukocytes, and it leads to immunosuppressions. And just like I said, antigen and antibody complex during these viral infections may lead to hypersensitivity reactions. I think it's hypersensitivity type 2 or type 3, okay? Or the viral disease practically not cause any symptoms. We call it asymptomatic infections. No clinical disease. The virus just quiet or dormant in the tissue. Or the virus can insert their genome, can insert their genetic materials into the host cell, and then it leads to silent infections that, if it occurs prolonged, it will cause tumor formations. For example, in the case of retrovirus infections. In animals, you will see some example of this. Okay, I'll explain it in the next slide. Here, this is acute cytolytic. Acute cytolytic means virus penetration into the cells cause necrosis. And then the cell lysis will invite leukocytes to release more cytokines and then provoke inflammations. And there will be some changes in the permeability of blood vessels. Okay, and then cell lysis will also release more virus particles that makes the virus can easily transmit it through blood vessels to other organs. For examples, in the case of here, herpes virus in human or even in avian influenza. Okay. So in here, cytolysis cell necrosis will release more viral particles that make the virus can spread or distribute it to other cells or tissue. Okay, and then viral cytolysis cause necrosis. Here, examples of necrosis due to viral infections. In the case of herpes viral infection in bovine, in cattle, or erosions of tissue due to foot and mouth disease. Foot and mouth disease caused by a aftovirus. Aftovirus, APHTO virus, aftovirus. Here, this is this is one of good example. These are good examples of cytolysis during viral infections. And then, just like I mentioned, virus can make proliferative response. Viral infections makes proliferative response because the virus will bind their nucleic acid into the host genome, and then they will modify the host genome to induce more cell proliferation. Okay, this is for can be found in the case of oncogenic virus infections. Okay, and also in non-oncogenic virus, for example, pox. Sometimes in pox, infections with moderate amount of virus can cause epithelial proliferations or mucosal proliferation. So the mucosa or skin can be more thick, okay, due to these infections. However, in the pox, eventually it will also lead to necrosis. Here, this is the necrotic part of the cowpox, but also in the surrounding area there will be thickening of skin due to epithelial proliferations. Okay. This is also, I think, in the teeth of a cow. Here, this is the necrotic part, but the surrounding area is more thick due to epithelial proliferations. Here, this is examples of pox in a turkey. The black part representing the necrotic area, but the thick part around this black center usually related with epidermal proliferations. Okay. Viral infection in the skin can make various lesions. The skin lesions can be in the form of mercules. Mercules means spotted skin, and it's flat, okay, and it has discolored area. The size can be vary, can be less than 1 centimeters, but can be very small foci or large foci can be seen. Papule, there is elevations of the lesion in the skin, but no fluid presents. Okay, it can be small, as large as the pinhead, to even 1 centimeters. And papules can also make discolorations in the tissue. In the acute stage, usually they will have hyperemia. They will have a reddening of the affected tissue. Okay, or it can form into rash, papular rash. Fascicles is a elevations also in the skin or mucosa. Can be small. Okay, usually if it's more than 1 centimeters or large fascicle, we call it as bulla. And fascicles is a sacs that filled with serous fluid. Okay, if the fascicles filled with pus, we call it pustules. And if there is bulging just under the skin or underlying capsules or mucosa, we can call it nodules. Okay. I'm gonna to show you some of the examples in the further slide. This one here is macule. So macule can be characterized by flat lesions. It can be discolorized like this. There are discolorations like this one here and here. It can be brownish or maybe dark like this one here. However, it has flat surface. Usually this color change might be due to some degenerative lesions in the epidermis. And this one here, papule. For papule, there will be bulging. It can be variable in size, small or large, and then the papule has a solid structure. Okay, it can has reddish appearance, sometimes dark also, or it has similar color as the surrounding area, but it has bulging. Okay, and then this is the microscopic appearance of papules. Here, this is the convex or bulging surface, and it has a cellular proliferations under the epithelia. Here, under the epidermis, maybe related with leukocytes infiltrations. Okay, so papules can affect the epidermis and also dermis. And in papules, although it's not clearly seen, but there is also some degenerative changes in the epidermis. And this one here is fascicles. Okay, it means usually fascicles related with lesion in dermis. Lesions in epidermis. Okay, I repeat again, fascicles related with lesion in epidermis. So there will be fluctuations. There will be sacs that filled with serous clear fluid. Okay, if it's small, less than 1 centimeter, we call it fascicles. If it's large, okay, more than 1 centimeter, we call it bulla. Fascicles or bulla filled with clear plasma fluid or serous fluid. However, if the fascicles filled with pus, we call it pustules. Usually pustules related with abscess formations. This one, an intraepidermal pustules. Okay, intraepidermal pustules here. These pustules, not dermal, sorry, but intraepidermals. This is the epidermis, this is the dermis. Pustules will make fluctuations, sacs that appears as fluctuations that contains a lot of necrotic cells and also many neutrophils. Here you can see many neutrophils. Okay, next slide is about nodules. So for nodules, just like I said, there is lumps. The lumps located in the dermis or in the subcutis, and the lumps can be vary in size, 1 centimeter or less, or maybe bigger than that. So some nodules related also with granulomatous inflammations. Some viral disease usually not cause granulomatous inflammations. However, some bacterial disease may cause this lesion. Okay, And asymptomatic viral infections means there is no symptoms appears in the infections, and asymptomatic infections related with low viral replications with minimal or even no lesions in the host cells. And then in asymptomatic infections, there is minimal, even without any viral insertions of genetic materials into host cells. However, no viral replications. However, there is genetic insertions of nucleic acid or viral into the host cells, but not active. In some conditions, the virus can be activated and then replicates if there is some supporting conditions. One of the examples in the case of herpes virus. Herpes virus can be dormant. They can be quiet. But in case of immunosuppressive conditions or extreme stress, there will be the infections will appear. Okay, there will be bursts of infections occur. Now, this is interesting fact about viral disease. Viral disease not only causing necrosis, but affected nucleic acid, it means affected host nucleic acid, can be somewhat modified by virus, and then this modified host nucleic acid will provoke or initiate oncogenesis. There will be formations of neoplasma. Okay, some viruses act like this. Usually oncogenic virus, and it takes long or prolonged infections. For example, cases of retrovirus causing lymphoid leukosis in animals. Here, this is the liver tumors, multiple liver tumors in the liver of a chicken due to lymphoid leukosis, or herpes virus that causing Marek disease in chicken. Okay, similar appearance. And to detect virus presence in the tissue, we can apply some methods. For example, the most simple methods is using the hematoxylin eosin stain. This is the most common stain used in the histopathology to detect the inclusion bodies or syncytial cells. Inclusion bodies can be inside the nuclei or inside the cytoplasms. Some viruses can have their own characteristic of inclusion bodies. It can be inside nuclei or inside the cytoplasm, or both. Okay, and then viral infections may appear also as syncytial cell. Syncytial cells is a fusion of many cells that form one big cells with multiple nuclei. Okay, so here in these pictures you'll see a inclusion bodies. This is this arrow pointed inclusion bodies here. In this rabies inclusion bodies, the inclusion body located in the cytoplasma. This is the nucleus. This is the inclusion body. We call this rabies inclusion body. Inside the neuron cells, we call it Negri body. Negri is the founder of these structures. Okay. And then this one here is the syncytial cell. Syncytial cells also called with giant cells because this is a large cells These cells originated from fusions of multiple cells into one large giant cells. Okay, and here this is the cases, I think, in the cases of herpes viral infections in the dogs. Here this is the giant syncytial cells with many nuclei, but in here you can see that the nuclei here occupied by a purplish material inside the nuclei. This is what we call as intranuclear inclusion bodies. Fusion of cells, we call it syncytial cells, but some of the syncytial cells contains, in particular the nuclei contain purplish inclusion bodies. Purplish inclusion bodies, we call it as basophilic inclusion bodies. So in intranuclear inclusion bodies, you will see that the inclusion body occupied the inner part of nucleus, and it makes the chromatins, okay, that contain chromosomes and DNA will be eccentrically located, will be eccentrically placed. So you can see here there will be a thickening of nuclear membranes. Some thickening of nuclear membranes that actually an aggregated of eccentrically placed chromatins here. Okay, please distinguish or differentiate between cases of intranuclear inclusion bodies with intracytoplasmic inclusion bodies. There are good examples here. This one here, intranuclear inclusion bodies, but in here, this is the intracytoplasmic inclusion bodies. Okay, sorry, I made mistake. This is not in the case of herpes virus in dogs, but this is from the case of distemper virus in dogs. Okay, usually in distemper, we can find both intranuclear inclusion bodies and intracytoplasmic inclusion bodies. Okay. Then the next methods to detect virus, we can also apply an immunohistochemistry. For immunohistochemistry, we use a specific antibody against the virus antigen. And then if there is a binding between antigen and antibody, okay, sorry, I made mistake. This is antibody with Y, sorry. If there is, okay, I'll back with the immunohistochemistry. So if there is binding between antigen and antibody, forming an antigen antibody complex, it will make this complex easily detected by applying some coloring substance or chromogen. And then the appearance of positive reaction in immunohistochemistry will be like this. The chromogen can be vary. It can give red color or even can give brown color. Okay, so if there is color changes, if there is some color changes detected in the tissue, we can consider that these cells are positive against the virus. Okay, this is the virus positive cells, and this is the negative controls, all negative, no appearance of this reddish chromogen signals. And then next is one of the most interesting infectious agent. Virus, bacteria, fungi, parasites, all are alive microbes. they have nucleic acids. Okay. However, there is proteins that infectious. It means it is not an alive organism. Okay. One of that infectious proteins, we call it here prions. A proteinaceous infectious particles that is, sorry, I will fix this later, heat resistance and also proteases resistance. Prions, this is a non-living materials, can cause disease in animals. The name of disease are scrapie. This is familiar in goat and sheep, or the most, I think the most well-known disease, BSE or bovine spongiform encephalopathy or mad cow disease, or some other transmissible mink encephalopathy. This TME found in the Europe, some cases also reported in USA, and wasting disease of deer. This is cases found in USA, okay, causing a significant emaciations and cachexia in the deer. Okay. These are some examples of transmissible spongiform encephalopathy, scrapie, TME, chronic wasting disease, or the most well-known BSE. So this prion can cause disease in human. We call it the CGD, Creutzfeldt-Jakob disease. This is related with mad cow, or this Gertzmann-Straussler-Seinker syndromes, insomnia, and also Kuru. This Kuru is ancient disease found in the New Guinea due to cannibalisms. Okay. Okay, the symptoms of mad cow disease is ataxia and tremor, because it affects mostly the central nervous systems. Okay, just like this one here, the cattle kicking violently, and then a cow with BSE, okay, usually leaping over, they are jumping without with uncontrolled movement. And the prion can be two types. There are PRPC, proteinase protein C, or PRPSC. The difference is PRPSC are more protease resistant and not so soluble, but it has what we call as beta C. Okay. However, the infectious form are this one here, PRPSC. Okay, so in short, that this PRPC will be internalized into the cells through the endosomes, and then the PRPC will produce PRPSC, and PRPSC will be released from the cells and then infecting other cells. Okay. When the PRPSC released from the cells, it will lead to cellular necrosis. Okay. The type of infections or the mechanism of infections is similar with virus. The difference is this is a non-living materials. Virus still contains nucleic acid, whether it's DNA or RNA. However, for this prion, they do not contain any evidence of living materials. Okay, only proteins. Here, this is the PRPC and this is the PRPSC. You can see here the bones here. The bones are more many more in PRPSC, it makes these molecules more infectious. Prion in cattle causing a progressive changes and degenerative damage in the neuron, particularly neuron. Okay, it causes a neuron fasciculations that reflect the degenerative process, and then it takes long time until the neuron become lysis or necrosis, and then the necrotic neuron will be replaced by accumulations of glial cell or gliosis, and this is produce what we call as sponges. We call this as sponges. Sponges can be as gliosis area with also fasciculations within the neuron. Here, this is fasciculations within the neuron. After cellular death, the PRPSC also can, after cellular death and release more infectious form, this PRPSC will also internalize within the neurophils. Neurophils, a part of brain that mainly composed of the axon, and then axon damage will lead to neuropil fascicularizations. This is the normal neurons. This is neuron with internal fasciculations in the cytoplasms. From here, it will also can develop into this neuropil fasciculations. This one here, this is fasciculations within the neuron cells, and this is fasciculations in the neuropil. Okay, so usually started first with this one and then develop with this neurophil fasciculations. These fasciculations refer to spongy area. Therefore, this is called as spongiform. And there will be minimum tissue inflammation, tissue inflammatory reactions, minimal tissue inflammations. Therefore, this case is called as encephalopathy instead of encephalitis. The portions of brain that usually collected for BSE sampling is this obex. Obex is part of brainstem, just under the cerebellum. We will find more prion in obex. I don't know the exact reason. However, obex contain a lot of large neuron, and it will be easier, much more easier to find the fasciculations by collecting obex. Okay, obex, just I repeat, just under this cerebellums. It's located in the brainstem. Okay, here the obex, just in the beginning of spinal cords. Okay, here. And then the spongiform lesions, very common in prion disease, not only in BSE but also can be found in the cases of scrapie in the goat and sheep. Here, this is the neuron cells, this is the nucleus of neuron cells, and this is the fasciculations here, fasciculation here. Okay, multiple fasciculations. To detect prion, because it kinds of proteins, we can apply immunohistochemistry. This is the brown chromogens, we call it as DAB. It stains positively the cells with prion here and here. Okay, this one here I think in the pair patches of ileums, and this one here in the spinal cord, and this all in other organs, and here this one here in the obex. Okay, but as you can see, many of the positive cells mainly found in the central nervous systems. Next, I'm going to talk about bacterial diseases. Based on tissue response, bacterial diseases can be categorized as pyogenic diseases. Pyogenic means it produces pus or suppurative exudates, and for pyogenic infections there will be a lot of neutrophils and necrotic cells. And then there will be toxigenic bacterial disease. It means the bacteria release toxins. Okay, and then bacteria also can act like virus. Some bacteria with small size can penetrate into the intracellular area. Okay, and then they can replicate just like virus, and it can replicate in many type of cells. Okay, in many cases can replicate in the macrophages. So in pyogenic bacteria, it can affect many tissue, and then pyogenic infections may also lead to systemic infection called septicemia. The common species of bacteria that can cause pyogenic infections is Staphylococcus or Streptococcus. There are many other type of bacteria can cause pollen infections. However, Staphylococcus and Streptococcus considered as the most dominant bacteria. It causes pyoderma. It means abscess formations in the skin. Okay, and also producing pustules. Histopathologically, in pyoderma, there will be a lot of necrotic cells. We call necrotic cell as debris cells, and also infiltrated by leukocytes, in particular neutrophils. Okay, chronic infections of pyoderma can lead to granulomatous inflammation, for example, caused by actinomyces, some Pseudomonas or Staphylococci. Here, this is pyoderma caused by Streptococcus or Staphylococcus in the paw of a dog here. Okay, this is a abscess formation here in the paw of a dog. Okay, and the abscess usually located in the epidermis. Epidermis and also affecting dermis because it's called deep pyoderma. Type of toxins that can released by bacteria is endotoxins. Endotoxins actually released by a dead bacteria. Endotoxins known as LPS or lipopolysaccharides. It's a large molecules because it contains lipid and polysaccharide, and only exclusively found in a gram-negative bacteria. Lipopolysaccharides will lead to some septicemia or sepsis and initiate the event that called as endotoxin shock. Okay, and then lipopolysaccharides may lead to endothelial necrosis that eventually resulting in hemorrhages. For example, in the case of Pasteurella, E. coli, or Salmonella. Okay, lipopolysaccharides will induce the macrophage to release more cytokines that can be also destructive to the tissue. Here, this is the blood vessels. Okay, large blood vessels in the lung with necrosis in the blood vessels. Okay, that causing hemorrhages. Here, this is the hemorrhages, and then here, this is the liver that from a duck that experimentally infected with Pasteurella multocida. You can observe here, this is the formations of thrombus. This thrombus also can cause a ischemia and necrosis in the surrounding area, and destructions of endothelial cells may initiate the vasculitis or blood vessel inflammations. Then the bacteria also can produce exotoxins. Exotoxins released by living or viable bacteria, and exotoxins produced by gram-positive bacteria, for examples like Clostridium or Staphylococcus. There are many types of exotoxins. You can see here, these are all the examples of exotoxins. There will be, I think, maybe hundreds or maybe thousands of exotoxins that's specific in some bacteria. And then there is also a type of exotoxin, we call it enterotoxin. This enterotoxin may initiate diarrhea. For example, toxin that produced by E. coli or Salmonella. Okay, E. coli or Salmonella. All of these toxins may be related with some disturbance in the absorptions of water in the intestine. And also this enterotoxin cause damage in the epithelial cells that makes the water cannot absorb properly. There is also another examples of enterotoxins. One of the well-known enterotoxins, for examples, tetanus toxins. Tetanus toxins is a neurotoxin that can cause a stiffness in the muscles. We call it spasms because it affects the receptor in neuron of ganglion, which cause frequent and intense contractions in shorter periods for a long time, and it will lead to a paralysis of muscles. And then tetanus toxins also can be in the form of tetanolysins. This tetanolysin causing the host cell lysis, causing necrosis. And then there is also botulinum toxin that can cause neurotoxicity, causing stiffness in the neck. We call it limber neck, or botulisms. This Clostridium botulinum toxins, I think you're familiar with that. This Clostridium botulinum toxin is, we call it as Botox, botulinum toxins. Okay, usually low dose of botulinum toxins can be used for cosmetic purpose. Then toxins released by Clostridium perfringens can cause a disease. We call it as gas gangrene. Gangrene means necrosis that infiltrated by a putrefactive bacteria like Clostridiums and producing gas. Okay, there will be what we call as emphysema in the organs. And Clostridium perfringens also well known for causing necrotic enteritis in poultry. You will learn this maybe in the avian pathology, maybe in semester 8. Some bacteria also can reside within the host cells. We call it as intracellular facultative bacteria. For example, Mycobacterium, Salmonella, and even Brucella. They can act like virus, replicates within the cells. However, they have differences because in virus they will penetrate the nuclei, but in here the bacteria will replicate, will grow or proliferate within the cytoplasma. To detect bacteria, we can use the most common methods, but not specific, by using hematoxylin eosin stain, or we can use gram stains. I think gram stains, you already learned that in the microbiology. And then we can use some specific antibody against some bacteria, and then we can apply immunohistochemistry to detect bacteria or common isolations of bacteria can be applied as well. Okay, this one here, this is the pictures of bacterial colonies inside a capillary in the heart of chicken. Here, this is the kind of bacteria. This is the color of bacterial colonies using HE. Okay, just purplish. However, if we apply the gram staining, we will find it has a gram-negative appearance with this pink color here. Okay, next it will be about fungal disease. Fungal infections or fungal infections or fungi in general can cause 3 types of disease in animal. It can be direct infections, we call it mycosis, or fungi can induce hypersensitivity or allergic reactions, and fungi can also release toxins. Fungal toxin, we call it as mycotoxin, and usually these mycotoxins act as secondary metabolites. The fungi not infect the tissue, but the metabolites may ingest it or may enter through some oral route or other type of routes, but mainly through the oral routes of exposure. In general, in our experience, fungal infections occur frequently in the immunosuppressive individuals, and many cases of Aspergillus infections due to aerosol infection or airborne infections can be found in many animals. In our experience, cases mainly found in chicken. Some also can be found in many other avian species and also mammals. Aspergillus can cause granulomatous inflammations in many organs, particularly in the lung, because it's related with airborne infections. Aspergillus and also other fungi, they have complex structures of cell that compose of polysaccharides, and it makes the fungal structures not easily phagocytized by macrophages. Such events will cause chronic infections that leads to granuloma. This one here, this is small nodules in the lung of birds, okay, due to aspergillosis. And we can detect the fungal structures by applying HE or PAS. PAS is periodic acid sieve, usually used to detect carbohydrates because fungal cell walls has many polysaccharides. It can absorb PAS stain. Positive PAS stain will be magenta like this here. And then fungi producing also secondary metabolites that act as toxins, okay, or we call it as mycotoxins. Chronic mycotoxicosis usually affect liver or kidney, and in the case of liver, mycotoxicosis will cause necrosis. Massive and chronic necrosis, massive necrosis will cause inflammations. Chronic inflammations will lead to formations of liver fibrosis and proliferations of bile duct. This is very common. In the case of chronic mycotoxicosis, there will be bile duct proliferations, maybe as a response of liver to release more bile acid to the intestine. And some mycotoxin also can be absorbed into the cells and then causing mutations or even necrosis of the cells. Some mycotoxins, for example, toxins produced by Aspergillus, we call it aflatoxins, may cause inhibitions of protein synthesis in the leukocytes, in particular lymphocyte, that makes there will be no significant productions of antibody or other cytokines and this mycotoxin also can cause mutations and then evoke the tumor formation. Okay, this is the liver affected with aflatoxins. This is the normal one. More mycotoxin will cause more damage, and there will be more pale liver, or even the liver can be atrophy or become smaller. Okay, and chronic mycotoxicosis will lead to what we call as liver cirrhosis. Liver cirrhosis means an extensive fibrosis because there are many damaged hepatocytes that infiltrates by fibrous tissue. Okay. The necrotic hepatocytes in mycotoxicosis, if it's has a prolonged exposure, will make the necrotic hepatocytes replaced by fibrous tissue. A lot of fibrous tissue will lead to liver cirrhosis. Okay, the liver will be smaller, will be atrophy with bulging and hardening of the surface due to scarring. And this is cases of ochratoxins or ochratoxicosis that mainly causing kidney degenerations. There will be kidney swelling with pale discolorations like this and here, like this and this here. Okay, ochratoxins mainly affect kidney, although in some cases also affect liver. Next is about protozoal disease. Only small number of protozoa can infect animals. For example, Entamoeba, Toxoplasma, Babesia, Anaplasma, and others. And protozoal disease usually transmitted by factors. And these factors at least contains one stage of protozoan life cycle, and the life cycle will be intracellular. And protozoa causing damage because they produce toxins that can cause cell destructions, or they produce some enzymes that also destructive to cell membranes, or they inhibit the metabolisms. Okay, and all of these protozoa causing cell lysis. For examples, in the case of Babesia infections causing damage in erythrocytes that leads to anemia, or coccidia in the chicken causing extensive hemorrhages and necrosis. This is the cecum of a chicken that affected by Emeria species. Okay, I think you will learn this in the endoparasites. This is the hemorrhagic cecum because there is massive proliferations of Emeria protozoa in the mucosa. This is a hepatitis caused by Histomonas meleagridis in a turkey. It can also found in chicken. It has what we call as button-shaped necrosis. This is the active necrosis in the center with dark color surrounded by the tissue reactions, usually surrounded by some fibrous tissue and also inflammatory cells. Yeah, these lesions very specific for Histomonas. We found some cases, in particular in chicken, and small number in turkey. And parasitic disease, besides protozoa, can be also caused by helminths. Sorry, this means helminths, worms. It can be cestodes, nematodes, or trematodes, and also insects. And I think nematode is one of the most common worms that cause a significant economic loss, although some trematodes and cestodes also can cause the same thing. But nematodes, they have more species that cause disease in animal. Parasites may lack of tissue response because they express some protein in their surface that reject the tissue response or not recognized by the leukocytes. Some parasites also can secrete toxins that induce allergic reactions. And typically, there will be infiltrations of eosinophils in the helminths or insects infestations of helminths or insect infestation in the tissue. I don't know why eosinophils, but maybe related with productions of histamine. Okay, you know, eosinophils contains a lot of granules that contains histamine. Mechanism of tissue injury by parasites can be due to obstructions, chronic irritation, and even destructions of cells or destructions of epithelia. Obstructions, for example, in the case of Dirofilaria immitis, this is very common in dog, that causing obstructions in the large blood vessels and right side of dog's ventricles, right side of dog heart ventricles. Ascaris causing obstructions in the intestines, and it may cause also extreme dehydrations, or Metastrongylus can cause obstructions also okay, in the pigs. Metastrongylus causing obstructions of a bronchus or bronchioli in pigs, And there are some liver fluke like fasciolopsis causing a obstructions in the fasciola, and fasciolopsis causing obstruction in the bile duct. Okay, and also irritations, for example, insects like fleas or lice, and destructions of epithelia because the parasites can make destructions in the epithelial surface. Here, this one is cyst due in the muscles due to Trichinella. Okay, you can see here the cysts do not evoke any host inflammations around the cyst. Okay, because the cyst cannot be recognized by the leukocytes. Okay, because they have maybe similar structures as normal tissue. This is granuloma in the monkey liver due to toxocaracanis. So some cases of parasites can be recognized by inflammatory cells, and then makes the inflammatory cells can isolate the parasites and then forming granuloma to inactivate the parasites. This is the most common case we found in the cattle. This is a fibrotic area in the hepatocytes or around the bile ducts due to this trematodes infections or fasciola hepatica or fasciola gigantica. We call the disease fasciolosis or fascioliasis. Okay, you'll find this fluke, we call it fluke, trematodes, we call it fluke, within the large bile duct. Okay, this one here, this is unique cases that we found in the necropsy room. This is the leeches. Okay, leeches that cause obstructions and hemorrhages in the trachea and bronchus of a leopard. And parasites also can act as factors for other parasites. For example, midgets, culicoides, can be factor also for other parasites like filaria, Diavofilaria, or Wuchereria bancrofti or Onchocerca, that causing a elephantiasis in human. And these parasites like culicoides also can act as factors of viral disease like blue tongue, African horse sickness, or viral encephalitis. Or for example, mosquito, Culex, Aedes also can act as factors for viral disease. We call it as arthropod-borne virus. Okay, virus that transmitted by insect. And parasites like some nematodes and also some mosquitoes, blood-sucking flies, they can take bloods, and if the infestation or infection becomes severe, it can cause anemia. Okay, and the parasites can take more blood because they produce proteins or enzymes that prevent blood clotting, and severe infestation or severe infection by these blood-sucking parasites in long term will cause hypoalbuminemia and also chronic iron deficiency. Okay. Oh yeah, I think you're familiar with these pictures. Maybe you learn ectoparasites. This is maggot. Yeah, living maggot that infested the tissue. We call it as myiasis. This maggot eats the flesh, eats the tissue, and then causing extensive necrosis and local inflammations. Okay. Yeah, that's all for this part 1. thank you for your attentions. I'm looking forward for questions. Have a nice day and good luck to you all.